Hii sasa
ndio
inabamba.
Yeah.
Let's talk about health. And we want to ask ourselves several questions about the dangers of health misinformation. So it started with health misinformation in the community. You know, kuna mtu pale anajulikana yeye ndio anajua mambo ya health. If you have any issue, you know, grab something for you. Some were actually knowledgeable through traditionally passed on knowledge on health and health treatment. Of course, the conventional medicine people come and say, no, those ones don't know a thing. But you tell them sometimes, just take a seat at the corner, I'm going to listen to this one. Okay, and then there are those who are just mushene people.
Yeah.
Because so-and-so alikuwa anaumwa na tumbo last week, akakula sijui nini akapona, so now that becomes the new medicine.
Charcoal.
And then now there's modern medicine where we have very many ways of finding out things about ourselves. We go online, we ask, and then the online search portal will bring you various sources as results. Some of those sources you actually see, you look and see, this person is calling themselves a doctor. Ata amevaa white coat na akona stethoscope kwa shingo, so this must be a doctor. And they start telling you things. How do you know that that's a doctor?
Yeah.
How do you know that this particular website is actually run by a professional doctor? How do you know that this person who's creating content online and, you know, saying this is, you know, what we've been doing, you know, as doctors, because, you know, we've been seeing these people coming to our facility and we have issues we've raised. How do we actually know that this is
Credible source.
Those are the questions we want to ask Dr. Hope Simiyu. She's a doctor. How do we know? She'll tell us. She's a strategic health communications and advocacy specialist. She's here. Good morning, Hope.
Good morning. You don't think I'm a doctor?
Atujui. How do I know you're a doctor?
Like for real.
For real.
You know, something that we don't understand is the government has made it very easy for us.
Yes.
So you just go to the KMPDC portal and you search by name. It will tell you the doctor's name, where they work, if their license is valid, and that's the information you need. And their number, their registration number. So the information is actually there.
Right.
Yeah. Yes.
Hope, are you on social media?
Of course.
What's your handle on social media?
My handle is Dr. Hope _C_me_you. Because of Hope Simiyu.
Okay.
Yes.
Okay. To welcome you to the conversation, Philaris, who is not on the KMPDC.
_W.
Blinky Penguin.
Who is not a doctor.
Who's not a doctor and doesn't claim to be one. Is going to give you the day's quote.
Labda daktari wa mitishamba.
You know, ule babu.
Alikuwa
anapatia watu
kutoka Tanga.
Ule daktari Bonoko. We have today's quote, which is courtesy of the first president of the Czech Republic, Václav Havel. And the quote is, "The tragedy of modern man is not that he knows less and less about the meaning of life, but that it bothers him less and less." The tragedy of modern man is not that he knows less and less about the meaning of life, but that it bothers him less and less. What do you make of that?
I think there's just so much happening that we've dropped what is important. Yeah, I think that's what I make of it. Yeah.
A girl of few words, but I like that.
Yeah.
And since we are here to speak to, you know, information, the literacy around health, the misinformation that is there, the voices are many. You know, Eric started off from those days in the village where it was, you know, mama nani alifanya hivi na akapona. In fact, pia unajikuna hapo, you have the same rash. You probably have the same thing. Where we don't even diagnose whatever it is and we rely on this. Sometimes it worked, sometimes it didn't work. Now we are living in a world where, like you said, it's noisy. Very noisy. And given that we also have a community system that has never changed, so if Marian comes and tells me, I'm more likely to trust what she says. And if I go online, if I have a community, then that becomes the point at which I'm like, yeah, you guys have filtered this enough. So what is health misinformation? What is health literacy within the context of what we are about to speak about?
Okay. And I think it's great you started from the community because that's where we are brought up. So that's like our idea of what is true and what is not. So it sets the foundation for us. So misinformation is basically wrong information that is passed out, but with no intention to harm. So most of the times it kind of feeds into our emotions and it kind of feels true. And you have this tendency to tell the next person. So that's basically misinformation. Let me just add an extra. So there's disinformation where you're spreading with the intention to harm. You know it's false information, but you're intentionally spreading it with the intention to harm. So majority of what we have today is misinformation because we want to know new things. I mean, there's so much information out there, but then we don't really know all the information. So what seems true to us is what we pass on. Then when it comes to health literacy, it's basically knowledge around health. Yeah. So how much of that do we know? How much don't we know? And what are the gaps that we need to fill? So for me personally, I am a practicing medical doctor, not clinically, but through my years working in the clinic, I realized there's a big gap in terms of just literacy, what people know about their health. And you spend one day at the doctor's office. The rest of the time, you're on your own. So if I'm not equipping you to take care of yourself when you're on your own, then it's like I'm not doing enough work because you'll be back with the same problem, if not worse. Yes. So that's how I just started getting into the communication space and health literacy space just to at least fill that gap.
Okay.
Yeah.
Talk to me about who is considered a health literate person, because we have standards for measuring like regular literacy. Can you read and write? Can you do basic arithmetic? How do you test for health literacy, or what's the standard for health literacy?
Mtu anajua kukohoa ni homa. Na kuumwa na kichwa, kuumwa na mgongo na joints, takusikia sijui aje kama malaria.
We need to leave that one behind, by the way. I wouldn't say there's like an exact measure to it, but it's basically building off literacy, what literacy is. You know how to read, you know how to write, but how do you comprehend the information that you're getting around health? Are you able to act on the information? Is it meaningful to you? So that's basically how we would assess now literacy. But you see, it has to start from, do you know how to read? Do you know how to write? So that basic level, and then now we build on it, bringing now the health component to it. And I think a challenge that we find is most times we don't start from like the foundational level. So you'd find a child at like class 6, we start learning about the reproductive system, but it's so surface level that we're leaving so much behind when we could be building that health literacy from the foundational level. So by the time you're 18 or like 20, you know what PCOS is. You know, when you're telling you about the ovaries and you know how everything works, you're not there like, hey, okay, fine, let me just go back and check what the ovary is. Not that you don't understand, but you know, it's just refreshing that memory.
Right. So that also when your period is extremely painful and someone tells you it's just part of being a girl, can be like,
yes.
No, I should actually go see a doctor.
Exactly.
Okay, I like that. Now, again, I know you don't have any concrete data on this, but just from your interactions with kawaida Kenyans, what's our level of health literacy as a population?
There actually was a statistic. I think I forget it. And the good thing about like Kenya as a country is generally our literacy levels are quite high. So we wouldn't say at least these are a big challenge there. I think, of course, there's disparities across different geographical areas, but like generally our literacy levels are quite high. When it comes to health, basic understanding also high. I would say like above 60% for basic level understanding on health. And I could be wrong, but like we'll get the concrete data, but it's very high. Now, the challenge we're having right now is now e-health, because now everyone is on digital platforms. So now learning how to decipher what is true, what is not true, what is a credible source of information, what is not, that's the challenge we're facing right now. So that has kind of like taking us back when it comes to health literacy levels, because people are getting really confused on digital platforms.
Should we go at all to digital platforms to ask any question about health?
Yes, I think so. How I look at digital platforms, they're a tool. They're just to make life easier. I mean, the same way you can do your Uber Eats, it's just fixing a problem that was there and making it easier and more accessible for you. The question is, how are you using these tools, and are they the right tools to use for your current concern? So I think it's a very good asset, and especially because not everyone can go to the doctor for every single thing, but if you can learn a thing or two around your health, that helps you decipher, this is an urgent call, this is an emergency, this I could probably go to the pharmacy, or this I could wait. So it's basically helping us as the healthcare providers, because the healthcare system it's strained.
Yes.
We are struggling. So if the patient can help us help them, imagine how we're helping the system.
Okay.
So I think the digital platforms are very helpful just from the knowledge perspective. But then we always say, at the end of the day, liaise with a trained and licensed medical professional. So don't take it as a diagnosis.
Yeah.
Take it as information that you can consult a medical professional on, and then get the diagnosis or get further information or instructions.
the same.
Yeah.
So that I don't come and say, Dr. Hope, so ni kama niko na typhoid, nipe dawa.
Yeah, you
What's
ready?
First of all, we don't consult online. We don't do consultations online, because I think we need to understand also just what a general consultation should look like. From a medical doctor's perspective, there's the history taking, which is you come in, you tell me, oh, Naskia, my head is hurting, and then I get to understand how long has that been happening, are there any other symptoms, we have a conversation. Then a follow-through must always be a physical exam. So I have to touch, I have to feel, I have to assess. If I don't do that, then I can't get a conclusive diagnosis. And then, of course, follow-up investigations are also needed. So there's a lot that we can miss when we're just looking at digital platforms to extract information and to get a diagnosis, rather than coming in and now getting that full diagnosis. And I know telemedicine has come in.
I was about to say, because I said,
Yeah.
saying, do your consultancy online.
Yeah.
Like,
Then you get
what do you
So-
mean touch feel? What's all that about?
I would say like telemedicine or like virtual care is like a triage system. So it helps us understand, okay, fine, we probably need to escalate this care, or we can, it's good for like patient navigation, where to direct you to for the next step. But it's not like a complete end to end. Yeah. In some instances, it can be, just because like if it's a video, I can tell you, okay, fine, let me turn to the side, let me see your veins, let me see this and that. But it's not 100%. So it is helpful, especially where there was an access gap, but then still concretely, we still need that physical exam.
Okay.
Yes.
So let's walk through how digital has evolved in terms of information, right? So it starts with not being able to ask anything online. It's basically you go online and you figure out which website to go to. You find a website. It'll not give you much information. May find a pharma website that tells you about a medication,
Yeah.
or you may find a hospital website that tells you these are the services we offer.
Yeah.
Or come in, and then search engine comes up, and now content is being created with the purpose of actually being discoverable online. So a user goes online and starts asking a question. Nasikia sijui aje.
What does that mean?
What could it be?
You know, even for us as doctors, we're like, you're nini. Like, what could it be? Yeah, we're like, let's take a step back.
What could that mean?
And then the worst thing is you're told, don't Google your symptoms, because it will tell you, you gotta buy a coffin right now.
You're dying right now.
But you see, as we're progressing,
Yeah.
that thing of going to ask, nobody's coming from a negative. Well, not many are coming from a negative point.
Yeah.
I'm basically at that point where I want to know, should I go to a doctor? Should I wait this out? Should I? I mean, sometimes when I go to a doctor, spend time, alafu daktari anakupatia maji ukunywe. After
Anakwambia, actually umechoka, hiyo ndio shida yako.
Kaa pale
Fatigue,
upumzike. I spent an entire day seated there, queue, nini, triage, nimepimwa, nini, nimelipa.
Mtu alikuwa kandangu, alikuwa nakohoa, sasa nimepata homa.
I didn't have much time. So it
Yeah.
was coming from that point of, I just want to know what this is. Could it be serious? Could it be not? Maybe, is this something I could just wait out?
Yeah.
And the search results would come with various sources. So there's this, the other. You compare, you read and you compare. Maybe you look at the first one and you're like, second opinion, close that tab, open the next one.
Yeah.
It's telling me something different. Let me go to hospital. Daktari, kuna moja imeniambia niko na hii, ingine imeniambia niko na hii. Wewe niambie niko na nini? You know?
Yeah.
And then we've come into deliberate content creation, which is somebody creating content and saying this is well-being, alternative medicine. You can think about your chakra and you're doing what? If you inhale, do how many times a day?
Yeah.
You're
You
gonna
know,
be
it
fine.
will help your overall well-being. We go into AI now with where you're actually querying and it comes and tells you, it samples all those things and breaks it down for you like a doctor with legible handwriting. You can read.
First of all, me, I'm not in that club, unfortunately.
Your handwriting your
It's
paper
perfect. It's so good.
We will go back to your lecturers.
Sample.
No wonder. No wonder
Sign
you're
for
saying
us.
you're not practicing clinically.
Yeah.
It's no wonder.
You have it right.
Please.
No,
So-
no,
Yeah, go ahead.
I'm not just.
With that
I'm not
entire,
right so that I can prove
I
it.
believe you.
with that entire evolution,
Yes.
there are very many changes. There are doctors such as yourself who are actually going online and giving us advice on preventive and promotive healthcare. Kunywa maji mingi, kula machungwa 3, kama wachana na apple. Kenya tuna apple.
Kula mandizi.
Kula mandizi.
Yeah.
Is that wrong?
It's not wrong. And I think it's good that you started from the beginning. But I think you missed an important element. So this actually just started from the community. Like, before, it wasn't normal for you to have access to so much information.
Yes.
Like, yes, books existed, but then are you going to look for a 1,000-page book in physiology? Are you really going to decipher and understand what that's saying? So people would talk to each other and talk to their doctors, but it was more of like a community knowledge.
Yeah.
Then now that moved on to platforms.
Yeah.
So ease of access, important platforms. And the platforms would give you credible sites initially because there weren't so many.
Yeah.
So you'd find there was WHO, there was CDC. Now we have monopoly. Like there's so much. So what happens is when there's so much information, we get overload, first of all. You don't know what is true and what is not. And then also now with the evolution of AI, like I'm sure you've gone to ChatGPT and you've put in something and they'll give you new sources.
Yeah.
Have you ever clicked those sources and there's nothing? Yeah.
Wow.
Yeah. So sometimes you ask yourself, okay, fine, is it really a credible source? And how did you start? So what I usually tell people is, okay, if you're going to use digital, be it AI, be it Google, first of all, pause. Think about what you want to ask it. Then ask the question. Based on the findings, get a number, as you were saying, compare. But it's also important to know what you're comparing with. So when you're comparing, you're looking for credible sources. And one that I say is very easy for like the layman, the NHS. It's so easy. It's created for the patient. There's also Mayo Clinic, there's Cleveland, and then of course WHO, MOH, now the government bodies, very important. So you compare across those lines and those fields. Then you can also use now ChatGPT. But if you're using ChatGPT, you have to make sure that you instruct it well. Because it can pull from anywhere. And remember, these are language learning models. They're trained by us.
People.
So it's not like they're super, super smart. It's us. So it's very possible that there are errors there. So as you're keying in the instructions, make sure it's very specific. You're looking for credible sources. I usually guide it. I'm like from NHS, from Harvard, from wherever. And when they bring you that information and they bring you the links, open that
on
link.
them.
Just to know that this is true, this is not. And I think sometimes because of the errors I saw with ChatGPT, now we have moved. So Anthropic, I think Claude is a bit more credible. I had Gemini as well from Grace Murugi. She's an AI specialist. So they're a bit more particular and a bit more credible. So Gemini and ChatGPT. But it's always important to find out if that source is an actual source.
I like that we're speaking about source
Yeah.
because sources are not just the ChatGPTs, the Geminis, the
Yeah.
Claudes. Let's speak to the people that are within the social space who are doctors, who have now they're content creators because
Yeah.
they're creating content around health issues, and those have become very accessible information sources. Now, the way the algorithm works is if you use certain words, then your content gains more traction.
Yeah.
So when I see numbers, there's a conditioning we have is like, this is believable content because it's been reshared. People have shared it. Meanwhile, I find a doctor who has lesser views, I'm like, daktari ni kama siwezi muamini because watu hawamwamini, the content is not being shared. So let's look at that space as it stands right now. Verifying, first of all, the doctor who's giving you this information, because I could come online and call myself, like right now, mental health wellness expert.
Yeah.
Who has certified me as that? So the person consuming that information, how do I go about making sure that this source is a source I can trust. Number two, beating the algorithm, because the algorithm is also at play here. And the third, the information that is being shared by these doctors. Again, here we have NHS, we have MOH, we have all of that. Hii ingine inatoka kwa mdomo ya mtu, by the way. Anasema ukikunywa activated charcoal utapona kila kitu. Let's look at that space.
Okay. Thank you so much for asking that, because I'm constantly fighting the algorithm. At this point, they'll want you to dance, to jump, to do. I'm just like, no, I just want to talk, and that's it.
I'm not here for your entertainment.
Like, there are people who dance, and that's fine.
Yeah.
That's not my gift, unfortunately.
Yeah.
But going back to now that algorithm, there's actually a statistic from WHO that 70% of what goes viral is misinformation. And I guess it's because it will do numbers, and of course, these platforms like engagement and they like numbers. So we're constantly fighting. Yeah, it's
60%
unfortunate.
of Kenyans drink 2 liters of soda a day. That's going viral, guaranteed. Guys will be like, what?
Yeah. So I think there's that, but there's also the element of there's a trust issue with the healthcare system, and we can't overlook that. So people have lost trust, and they're looking for alternative sources of truth. So what is sensationalized, what seems a bit more real and more relatable to them, is what they tend to go with. So we're fighting to bring back trust into the system. It's a process. I don't think it will change overnight, but we're really fighting. And for the algorithms, what I think the bodies of like WHO are trying to do is to work with them. So they have a program called FIDES. So FIDES is a health content creator program. So they aim to combat misinformation and to put credible information out there. And for any health professional to join FIDES, you have to submit your licensing. So at least in that program, everyone here is registered in their region. Whether you're in Asia, whether you're in Africa, wherever you are, you have to submit a document that says that in Kenya, I'm authorized to work as a medical doctor. And nutritionists are on as well, nurses, just the whole health fraternity. So that's one way that you can look for a credible healthcare provider online. Number two, of course, I mentioned KMPDC. And then I think there's a question that you asked on now how to work around the content. I think this is the hardest part, but what I tell people is just pause. Just pause. When it comes to digital and social media, you're not outsourcing critical thinking. You're still the critical thinker here. You still need to utilize, your brain capacity. So as you're listening, do your due diligence after. So what I said, go and verify, is what they've said in line with what the credible platforms are saying.
Right.
So you have to cross-check and just verify. And I wouldn't even go into like peer review and like research papers, because what we've also understood is we don't know how to interpret research. People just read titles and go with that. You don't know if that's a conclusive study or it's just the beginning. So
It's also time even if you do know how to do it, it's time intensive.
It is. Then that's why more researchers online. Where's the camera? We need more researchers online to teach us how to decipher the information that they have. But just looking at the credible sites and confirming it with what the healthcare provider has said is one of the best things you can do. And then take it a step further. If you have access to your doctor, these days, your doctor is on speed dial or on WhatsApp, just ask them. Or even on Instagram. I get so many people who actually just forward what they've seen. Doc, is this true? Is this true? Is this true? And I just answer based on what I'm able to answer. And sometimes I'm just like, let me look a bit more into it and I'll come back with a conclusive answer. Yeah.
Which is fair.
Yeah. So don't outsource critical thinking.
That's a big
That's
one.
a one-liner.
Tumia akili yako.
We'll take that home for sure.
And even on the podcast, sorry, just to interrupt. So on my podcast called The Dose of Health, I always make it clear that this is not a diagnosis. Please go and speak to your doctor, your healthcare provider. This is simply information, but take it further with a healthcare provider. Yes.
That's just a rider. It's those riders, let me tell you, in life, we have riders everywhere.
Yeah.
Consumption of alcohol is harmful.
No, but you see, you have to
Park at your own risk.
Park at your own risk. Park at your own risk.
Yeah.
Management reserves the right to
Litigation,
admission.
Rider does not give you anything. Look, if you want me to trust you, so yes, this alcoholic beverage company has added alkaline there because the law requires them to do it.
Of course.
Because they feel, morally obliged to put it there that consumption of alcohol is harmful to your health. So are you making it? I have already decided,
Yeah.
and we have agreed
Yeah.
that I am going to consume it.
Yeah.
So these are things that you're saying. You think I'm not going to focus on that, which is why you've put it on small print. Fine.
Yeah.
No, why I need you to
Small
focus
disclaimer.
on it is because you can be listening to me and diagnosing yourself. You're like, oh my goodness, yes, my leg was swollen yesterday. It hurt today.
Yes.
And you're diagnosing yourself. So
Of
I would
course.
say I have to do that so that you can escalate to the next step and
You're
don't take
doing
this
that
as
to
truth.
protect yourself. Hope.
No.
So I can't come and you want me.
Okay, two
You
truths
want
can
me to be
true.
coming.
Two things can be true at the same time. Yeah.
You want me to be coming to a Dose of Health podcast.
Yes.
Right? Constantly. And you consume health information.
Yeah.
And develop a level of trust
Yeah.
on Hope. Simiyu.
Yeah.
I can even go to the KMPDC and establish, yeah, she's a doctor. So,
Yeah.
So she'll tell me, yeah, consult your physician. I'm like, but you're my physician.
No, when did I become your physician?
You know, but you're I consider you my physician.
Everything
That's why
I
I'm
know
consuming.
about health, I know from you.
I
I know from her.
And that's why it's just information. So you need to go to the next step.
All right.
So it's
Yes.
just data collection.
It's not data collection.
It's not data collection.
Where data sharing.
Yeah.
Data sharing.
Yes, data
All right.
sharing.
It's information sharing.
Yes.
Speak to me about
Yeah.
alternative medicine. And even the word, I don't know, it just doesn't sound
Yeah.
right. Like, what's alternative medicine? But yeah, growing trends online of everybody has now their specialty, holistic medicine, grounding. I don't know.
Yeah.
And we grew up with daktari wa mitishamba. Saa zingine kuna mganga hodari kutoka Tanga. Those are two very different things, by the way. But what is the internet doing to either make these things more prevalent or not? And is it a good or a bad thing? I know it's a very complex and layered question.
Yeah.
But yes, what's the role of the internet in the proliferation of holistic medicine, alternative medicine? And is it a good or a bad thing that we're seeing more of this content?
I wouldn't say it's a bad thing. I would say there might be good to it, but why we can speak to it as doctors is because we work on evidence-based science. So as much as traditional medicine has worked in the past or has not worked, as much as alternative medicine is working or is not working, if I don't have data to attach that to, then I can't speak on it.
Okay.
Yeah, so unfortunately that's our predicament. And I think the algorithms like new things, and alternative medicine is new, and we're in a curious space where people want to learn a bit more, and I've noticed people are curious about their health.
Yes.
So they
Coming
want
from
to
a good
learn.
place.
Yeah, coming from a good place. So they want to learn. So I wouldn't say it's a bad thing to have it there, but I think disclaimers are very important. Disclaimers, especially around statistics and around data and research. Yeah.
Give me an example of like an alternative medicine piece of mis or disinformation that you've seen.
Detox. Detox tea, detox this, detox that.
Yes.
That is the primary function of your liver. If your liver is not doing that, then you need to see a doctor. But there's nothing you can take that is going to detox your body. Your liver is functioning, and if it is, it's doing that 100% in partnership with your kidneys. Yes. So that's one.
So if the things that they give us detox
Yeah.
teas, are they essentially just laxatives?
Some of them have laxatives, but we'd have to look more into the ingredients. But a good number of them have laxatives.
So
Yeah.
you go to the loo and you're like, I'm detoxing.
Yeah.
Yes.
Okay.
Yeah.
I'm going to ask a bit
Are
of
you
a
not?
controversial one.
You're not, because what
Your
is
liver is
detoxing?
detoxing
You're just
you.
eliminating what you've ingested. Yeah.
And
Detoxing
detox-
is removing,
The toxins.
yes, which your liver and your kidneys will do.
Are doing.
Yeah. Even your skin and your lungs at some point.
Your organs are functioning as they should.
Yes.
I'm going to ask a bit of a controversial one, Dr. Ari, which is people with platforms and voices online
Yeah.
being almost like, I don't want to say authorities, but as people to sell either medical procedures, to sell some medicines. Think about semaglutides, the Ozempics, and whatnot. We've seen China take very big steps towards saying that unless you're a certified profession,
Yeah.
you are not allowed to make content speaking to these things. Is this something we should enforce here? Because we've seen not too long ago, we had a lady go through a procedure, a clinic was shut down, she died. There's a risk of it, that when I see you with working results, I decide, si pia mimi itakuwa tu hivo. So we also have to take into account that these people, yes, are very useful to some things, but when it comes to critical matters on health, misinformation, and health literacy, they occupy a space, and there's a direct effect on people consuming that information.
Yeah. I think I agree. To be honest, I like what China did. Just because it reduces the workload for us. Because, you know, when things go wrong, the patients come to us. So we're the ones with the burden at the end of the day. But what I would say is, I don't think it's wrong to share your experience. I think that's fine. But when it comes to selling, when it comes to recommending, now that is not right. Because remember, we have different experiences, we have different health statuses. So the way it worked for you doesn't necessarily mean it's going to work that way for me. You still need to have this conversation with an expert who can guide you in the right direction. And I think seeing how now the weight management conversations are going on online, I've seen a change. So I think after more regulations have been put in place, we're seeing less and less of mentioning of the medication and more of sharing your experience, which is fine. Because if you can share that and maybe like encourage someone to take charge of their health, you're not telling them what to do, you're encouraging them to take charge of their health and probably make that decision to go and speak to a healthcare provider who can help them, especially now because lifestyle conditions are our burden right now. That's currently what our system is currently working to fix. So conditions like clinical obesity, that's a challenge. So if we look at it from that perspective, I think it's helpful. But then we'll also have to remember there's a relatability bias, where because I know you, I follow you, I kind of see a bit of myself in you, I'm more inclined to listen to what you're saying. So I think creators also need to tread cautiously around what they're sharing
that information.
Because, you know, I don't know how to put it, but like for us, if you say something and it has a negative effect on a person, then they can sue. But now you see for content creators,
disclaimer or not,
they can't sue because I didn't force you. I just said what I was saying. If something goes wrong, that's on you. So I think they need to be a bit more cautious because you need to think of how this can affect someone
Other
else.
people.
Yes.
Dr. Simiyu,
Yeah.
the law prohibits doctors from advertising,
Yes.
right?
Yeah.
Even hospitals from advertising.
No, hospitals are allowed.
Not
And clinics.
to say we are here, yes.
Yeah.
To say we are the best in cancer treatment, no.
No, yeah,
Right?
yeah.
That's advertising. And also a doctor to say, come to me for...
Illegal.
That's
That's
wrong.
illegal. Yeah.
Now, people are circumventing that by going online. And they're directly advertising by indirectly creating this long content, which is basically saying, come to me and we can do this for you. So this is what China has done.
Yeah.
They've basically just applied that law online. Should we do that same thing here?
I feel like if someone is circumventing that and directly just, marketing, come to me, then I don't think that it should be allowed. But if you're looking at it as at a point of health education, I think that's important. Because something that we also see is people coming late for things that could have been solved earlier.
Yeah.
So if you look at it, doctors being more online and speaking to the conditions that they manage on a day-to-day, from a point of giving information, now you're creating informed patients. Informed patients can come to you, can go to someone else. So I don't think by you inadvertently being online, you're marketing yourself directly. It's part of it, but then if you're offering something else, then I think let's look at the value they're getting from the education. If you come to me, I think that's a benefit, but I don't think you're directly marketing yourself. Yeah.
But we see many who are doing that.
That one, clearly, the law states.
So how then do we apply that online? Because there's somebody who is online, yes, and the way they are tweaking that information is that come to me and I'm going to, this is the information that you need to know and come to me.
Yes.
I'm going to help you. Come to me. Like I had a patient last week who came and we walked through them, through the journey, walked the journey with them. In fact, Mariam, walk the journey with you. You're creating awareness, yes.
Yeah.
But at the same time, you are positioning yourself as the person with the solution.
Right.
Yeah.
Come to me.
And Mariam will come be like, Dr. Latif was amazing. Just the absolute best. I felt comfortable from beginning. Hello.
I have
Endorsement.
a question. I didn't say the person with the solution.
They are, but should they be advertising themselves?
Now,
as
to
the person
answer
with the
that,
solution?
I think we would invite now the regulatory bodies to say what should be allowed and what should not be allowed.
Fair.
Yeah, because I think like now it's like
Umtaki
the lines have been blurred.
self-regulation. Umtaki self-regulation. Okay.
Hey, we need someone who could you telling us where we stop right there. Yeah, but I think definitely the lines have been blurred.
Yeah.
Yeah.
I do agree.
Yeah.
Looking at a little bit of feedback coming in from YouTube. Okay, Kikombe starts on a lighter note. Never look up your symptoms online. I got an injury while playing football. Hold on. I looked up the symptoms and I was pregnant. As a man, I had questions for my wife, who was also 7 months pregnant at the time.
No, what?
Okay.
What was he looking up?
I don't know.
What question do you ask?
Nimefura miguu.
Actually, yes, nimefura miguu. Nasikia nosy, I don't know.
Yeah.
Ranson Makala is saying, telling us not to outsource our critical thinking is assuming we practice critical thinking in the first place. What if we don't?
Start.
It's an invitation to start.
Lenny the Steve. Wait until you get the medicine. Oh my gosh. Wait, you get the medicine is breastfeeding for a whole grown man like I am. What is happening with your what guys, what's happening? Okay. Jimmy Kwan says H. pylori is a cash cow currently. Remedies ni mingi sana but hazisaidi. What's your take, Daktari? And then Iveria says alternative medicine is more nutritional supplements. The problem of online prescriptions is the dosage. Mostly they're overdosed. Too much ginger, too much cinnamon, etc. And we'll talk about that actually. Let's begin with H. pylori as a cash cow. So many remedies, nothing's working. And then this idea of, yes, supplements. Oh, if you're a woman between 25 and 38, you need to be drinking magnesium sulfate, chloride, blah, 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 blah. Come on.
And
Go.
this Indian thing.
Ashagwanda, for you to calm down a
Helps
little
you
bit.
sleep.
Ne kama uko
And you see
on
some people
edge.
saying, it keeps me awake. So which is which?
Now, the supplements question is one that I'm constantly answering. What do supplements do? They supplement something that's lacking. So you need to have a deficiency. And for a good number of the micronutrients, we can test for this to see if you actually have a deficiency so that we can put you on something that will sort it. Most of the times we start with dietary recommendations before supplements. And then if you're on supplements and you have no, what's the word? I've just forgotten the word.
Deficiency.
Yes. If you're on supplements and you have no deficiency, it's basically not doing anything. Yeah.
But always you overdose on a supplement, can
You can. You can. Calcium and, calcium. So you can get things called stones, like kidney stones and the likes because of calcium. So that's why we say, please, 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 if you can get your vitamins and nutrients from your food and the sun, start there.
Okay.
Then now go to your doctor for your annual checkup. At least go and check, is my vitamin D low? Which for most of us, our vitamin D levels are low. You're in a building the whole day. Our apartments are facing window to window. Kids don't go outside as much these days. So of course there's these deficiencies, but we also need to see how low is it, and is this supplement giving you enough? Because we also have the daily recommendations,
Right.
and some of these things need to be prescribed by clinicians because there's also a dose attachment to it. So for supplements, I wouldn't say just do it over the counter. Just speak to your healthcare provider and they can advise you best. Yeah.
On the, is there
H.
such a thing as
pylori.
like, even before H. pylori,
Yeah.
like, oh, ginger, cinnamon, is there such a thing as too much of now? Or the things that we know, garlic is healthy, ginger is healthy, cinnamon is healthy, and so on and so forth.
I'll answer that question very simply. I think people confuse doctors and nutritionists.
Okay.
We're actually not nutritionists, so we haven't done much in that field. So a nutritionist would be better placed to answer that question.
Okay.
Yes.
H. pylori.
So I actually did an episode on H. pylori, and it's true, it has become a cash cow just because of the kits. So you go to hospital, you're tested, you're told, kuna H. pylori. So you're given the kit. It's 2 weeks, 3 medications. But what we know is there's a recommended test that we're supposed to do. And this test, it shows if you have an active infection. Because you can have H. pylori that is not active. So we'll find some traces in your blood.
Right.
But that's not the required test that should be used so that we say that you need medication or you need the kit. So we need appropriate testing first to determine that this is an active infection. And most of the times it's a stool test. And then after that, if it shows that yes, this person has active H. pylori, then we treat for it.
Right.
If you're being treated for it and the symptoms are still there, then we say go to the next step. Please see a gastroenterologist. That is a specialist for your gut. So they can be able to just assess more and see if you need further management, because H. pylori can actually result in gastric ulcers.
Yes.
So we need to maybe take this a step further if you're having the symptoms persisting.
Quick
I
one, though.
want to go back into what you've just said.
Yeah.
Still on the H. pylori.
Oh yeah, we're still on H. pylori. Good. Okay. I was gonna go.
Because you've started by saying, yes, it's a cash cow.
Yeah, it's
and
a
you've
cash
noticed it. Okay, people are going to hospital, diagnosed with H. pylori before some certain critical tests are also done. Daktari, are you suggesting that medical professionals are actually being, what's the word? This is malpractice.
I'm actually
your-
not just
By
suggesting.
your colleagues, you're saying.
I'm saying, and this is based on facts. So I don't know if you've heard of Willow Health Media. So they had a story published last year in 2025.
Yes.
And this was from findings across Nairobi and Kiambu County on what was happening. So this is what they found. And they actually say that, yes, we are not practicing in the right way. We're not doing the right test to determine that this is an active infection. And we're not doing that because there's a kit attached to it. The kit is the money maker. Yeah. But now you see, if I inform you as the patient, you know the right test for it.
Yeah.
You know this is an active infection and this test is not for an active infection. So you're able to engage with your healthcare provider and tell them, according to the research I know or I've done, this is what is recommended for H. pylori. So let's have a discussion around it. And then if you don't feel comfortable, please move to the next doctor. Because I keep telling people, if you don't feel comfortable in one space, you're not tied down there.
Yes.
Yeah.
Get a second opinion, get a third opinion. But yes, that was an actual story that was published by Willow Health Media. Yeah, around H. pylori.
So speak to us again directly. So if I go to a health practitioner and I'm told H. pylori, what should be my first reaction? Where what?
No, your first reaction
Uko
is,
sure?
what? I have H. pylori. So to do.
So to do. Okay. So first of all, it depends. If you came in with symptoms, then that is a different place to start. If you came in and they tested and they just found H. pylori, you have no symptoms.
Randomly.
Okay.
We usually don't treat.
Right.
If you have no symptoms, we don't treat.
Okay.
If you have symptoms and now they've told you you've done the stool test, H. pylori antigen is positive, we need to start treatment, correct. If you did a test and they don't tell you the antigen is present, now that is not indicative of an active infection. The
Watasemaje na Kiswahili? Chembe chembe.
Hey. There's a stool test and
Umeenda
there's a blood
hospitali.
test.
Daktari anakuongelesha Kiswahili.
Let me simplify it.
Aye.
So antigen will be detected in the stool test, antibody which shows previous infection in the blood test. So they already have at least, so if they've done the blood test, antibody, that can tell you it's a past infection, it's not current.
Okay.
So you can confirm with the stool test, which tells you there's an antigen, it's present, that indicates an active infection.
Okay.
So that warrants treatment if you're symptomatic.
And if you're not symptomatic, because I think a lot of people have H. pylori that is dormant.
Yeah.
So if you're not symptomatic, asymptomatic, does it cause any onward health complications or in a hang too?
In a hang too, but then the complications would come with symptoms. So we would know to treat.
So either way, the symptoms will speak.
Yes, the symptoms will speak. And the same for UTIs. And I tell women this because we are so keen on UTI antibiotics. Like, wait, pause. If you just went for a screening and they tell you have a UTI, you have no symptoms. We have something called asymptomatic bacteriuria. So yes, there's bacteria, but it's not enough for us to treat. And if you have no symptoms, we just let it clear on its own. If you have symptoms, we definitely treat.
Okay.
Yeah.
And there's no, so you see the human whatever is, a doctor is telling me I have this, yes, I have a UTI, I have or H. pylori, but it's not symptomatic. If left untreated, I've been told UTIs can cause complications, so can H. pylori. That's human nature. So is it you have to go and be counterintuitive. If there's no symptoms, no need to worry.
Yeah.
For those two things specifically.
Yeah.
Okay.
But I think that also speaks to the importance of at least an annual checkup because we have to make sure things are working well.
Yes.
So that if there's anything silently going on, we catch it early. So please do your annual checkup at least once a year. That's how we keep things in check. Yeah.
You know, Dr. Hope, you've been the first time I came across Dr. Hope is a piece of content on antibiotics and how we are developing a resistance to antibiotics. And we'll have that on a separate conversation, because then that's a whole monster on its own, because then we've become our own doctors. You feel like you have an infection, you go augmentin, pap, that's it. No one has prescribed that to you. So we're also very guilty of diagnosing ourselves. You're a young doctor, and you spoke of trust a bit earlier. I want to go back to that trust. Yeah, a lot of times people have this, and you know, people that are parents or ourselves, you go to a doctor, you see an elderly doctor, you're like, huyu nitamwamini because he's not there.
Experience.
He has experience. He's seen so many patients, and he knows something about this. And he's also not using maybe the new ways of engaging with him. He's at a hospital, at one my patients, and that's it. You come and find a doctor, you've gone to visit ako online, labda ameangalia ka chat GPT amesahau kuzima, and you're like, does this doctor know what they're doing? Yet they're certified, they're practicing, they know something about that. Help us bridge that trust gap between the ones who prefer the old doctors, not that there's anything wrong about that, and the young doctors that are brilliant at their work, but people just don't trust them.
I think that's a tough one. Yeah. But also you have to remember, even the older doctors started when they were young. Like everyone started somewhere. Yeah. But speaking as a young doctor, I think my experience was working in Mashinani. And in Mashinani, they're so welcoming. They're just like, oh, my granddaughter, she's a doctor. So I think it's different in urban settings versus in the peripheries. But just
watu town ni wajuaji. Just say it.
We call them informed.
Informed, okay. Like, I like that branding. Okay.
Yeah. But speaking to that, I think with the evolution of technology, but also how fast medicine changes, you constantly have to stay abreast with information. So personally, I don't think it's off-putting for a doctor to tell you, let's check this up together. But I think transparency is very important. I wouldn't be doing it chinyamaji. I'll just tell the patient, actually, let me just get more conclusive information, and then I can respond appropriately, because I want to give you the right information. And what you'll know is even the older doctors, sometimes they step out of the room just to confirm, go and read a book, because that was, their bread and butter, or go and confirm somewhere else and then come back. And it's not that you're deficient of the information, it's just that there's so much, it's hard to keep all that in your mind. So a doctor who actually takes the time to confirm and tells you that they're confirming, I feel like that's someone you can trust.
It's a good sign.
Yeah, it's a good sign. Yeah.
We expect doctors to be encyclopedias,
Hey,
and
this Simiyu.
Yeah. All right. On the question, just to go back on the supplement question a little bit, because we've talked about deficiencies and how they may be manifesting, but not so much on how, if we're creating artificial demand. You talked a little bit about it. Are we creating artificial demand and I talked about that content that's very sensational, that's like, if it's on your 30th birthday, this is the list of supplements you need to start taking. How do we rein that in? And how big is the proliferation of this artificial demand for supplements and for easy medicines? Yeah.
I think the simple phrase is the supplement industry is $1 billion industry. So they somehow have to keep it running. Yeah, and we are the targets. Yeah. But there's something, when I was speaking on supplements, I spoke to, and it's what Steve Jobs said. If you don't eat your food as medicine now, you will eat your medicine as food later. So start from the basics. All the nutrients you need right now are currently in your food. And of course, sometimes with GMO and, all this, there's some micronutrients you might miss or are not enough. So start from your basic balanced diet and the sun. Then is when you can scale up.
Okay.
Yeah.
Because we've had conversations here with people in either milling, food safety, and they're like, our food is incredibly deficient. it's a good place to start, but we're getting to a place where you can't trust what's on your plate, in the sense that if you're eating, for example, like white ugali, it has been sifted and yeah, there's nothing there mineral-wise, ni unga tu nakula, and so on and so forth across like the food value chain. But that's a conversation for a nutritionist, so I do get it.
No, but also just to add on that, some of the packets have fortified, like this, they say what they've added. So we can also just look into that. So whatever you're buying, just look for fortified options, because that ensures that they have the recommended nutrients. And I know this is not available to everyone, but then that's a good place to start.
It is.
Yeah.
But I think also the Ministry of Health and Agriculture have worked together on that and put it in law that the millers must fortify the maize meal with those ingredients. I don't remember what it was, but it's there.
B12 or something.
It's
or
there in
Get
law
salt
that you
with
must
iodine.
have the iodine and have it there. Saya to Misha. Okay. So, where do I find you now if I want to see all this information? Online.
You
to
find me
follow
on
your
Instagram.
content online.
Yes.
on the gram.
So on the gram, I'm Dr. Hope Simiyu. That's Instagram and TikTok. And then the podcast is A Dose of Health, the podcast, also on Instagram, on TikTok, and wherever you listen to your podcasts. So we are there. Yes. Yeah.
And the disclaimer is just consume information for information's sake.
Yes.
Yeah.
Not come to the podcast for a diagnosis.
Yes.
Go and see a
Consult
doctor.
a medical
Tuange
practitioner.
Usijidiagonise.
Okay. Aya basi, asante sana. That's Dr. Hope Simiyu, and this conversation has been incredibly insightful. And of course, consult a medical practitioner. I'll see you. Aya, we're getting into our next conversation on film as a mirror of African family realities. That will be on Your World. Winnie Lubembe will be in studio, and of course she has a few guests, including Jack Mutinda, who's an actor, Kit Kiarie, who's also an actor, and Omondi Ngota, also an actor. Film as a mirror of African family realities, when family, tradition, and change collide. Boom. Wow. Higher on Nation FM, it's Vibe Shift, Claudia Naisabwa and Brian Aseli. From myself, Mariam Bishar, of course Eric Latif and Falaris Wamboy. Have an amazing Thursday. Asanteni sana.